Hello, and welcome to this lecture on diabetes. Diabetes is sometimes also called diabetes mellitus, and it's abbreviated DM. DM, or diabetes mellitus, refers to a group of disorders that share the primary symptom of hyperglycemia. Hyperglycemia means high blood sugar. Hyper meaning high, emia referring to in your blood, and glyce standing for glucose or sugar. Hyperglycemia equals high blood sugar. Hyperglycemia can result from both defective insulin production, insulin inaction, or a combination of both. The two hormones that play the biggest roles in blood sugar control are insulin and glucagon. If you recall, both of these are secreted from your pancreas in a healthy person. Insulin is released in response to high levels of blood glucose. So if you eat food, it turns to sugar. A healthy person's pancreas should put out insulin to shuttle the sugar into the cells, resulting in a reduction of your blood glucose levels. Glucagon, on the other hand, is the hormone that is released from your pancreas in response to low levels of glucose in your blood. So if you haven't eaten for a long time, your blood sugar levels drop. A healthy person's pancreas would in turn stimulate the release of glucagon. And what glucagon does is glucagon stimulates the breakdown of liver glycogen into glucose. Because remember, as a healthy human being, you store glucose as glycogen in your liver and your muscles. And so in the event that you haven't eaten in a long time, your pancreas can break down the glucagon can tell your liver to break down glycogen and give your body glucose to fuel your cells even if you're not eating. So the effect of glucagon is essentially to result in a rise or an elevation in your blood glucose levels. Type 1 diabetes consists of somewhere between 5 to 10% of all cases of diabetes. Most people with type 1 diabetes tend to have their diagnosis earlier in life, usually in childhood. The cells in your pancreas that are responsible for making insulin are called the beta cells. And so with type 1 diabetes, it's an autoimmune disease, meaning that for whatever reason, the body starts attacking itself and actually ends up killing off the beta cells. So the beta cells are supposed to produce insulin, but if your body is killing them, it means you're killing your ability to make insulin. And so type 1 diabetes is characterized by an absolute deficiency of insulin. It's estimated that approximately 60 to 80% of your beta cells have been destroyed by the time a person is diagnosed with type 1 diabetes. Again, type 1 diabetes affects only 5 to 10% of all people with diabetes. Type 2 diabetes, on the other hand, affects somewhere between 90 to 95% of people with diabetes. People with type 2 diabetes do not have no insulin production. Instead, over time, their pancreas kind of runs out of the ability to produce insulin, and the insulin that it produces doesn't work that well. And that's usually due to the fact that most people who have type 2 diabetes are going to be overweight or obese. So think of all the people in the country, in the United States, who have diabetes. 5 to 10% of them will have type 1. The other 90 to 95% will have type 2. And of those people with type 2, more than 90% will be overweight or obese. So obesity and overweight makes type 2 diabetes so much worse because it causes what's called insulin resistance. And that basically means the insulin that your body may make doesn't work that well. And you can think of it primarily because the healthy cells are blocked by fat cells. When you become overweight or obese, your fat cells increase in size. And they kind of block off the healthy cells, meaning the insulin can't get in there. Things that increase type 2 diabetes risk include physical inactivity. On the flip side, if you are physically active, that increases the sensitivity of your insulin, which is a good thing. People who are very high or low birth weight have higher diabetes risk. And the people who are obese, over time, it increases pancreatic stress, which will lead to an overall insulin deficiency. So some people who have type 2, they actually end up having to go on insulin and to inject themselves with insulin because the insulin that they're making just doesn't work, or their pancreas eventually conks out and can't make any insulin. People with type 1 diabetes always have to inject insulin because their pancreas never makes any of it. A little bit more about the pathophysiology of type 2 diabetes. In type 2, your pancreas produces insulin, but your tissues become insulin resistant, usually because of overweight and obesity. So initially, your pancreas can make insulin, but over time, it will eventually, as I said, conk out. So type 2 diabetes, we say, is characterized by insulin resistance and eventual insulin deficiency. If you don't make enough insulin, or the insulin that you make doesn't work, what happens is your liver starts trying to make more glucose because your body's not sure what's going on, and your increased production of glucose from your liver causes high blood sugar too. So every overweight person will have insulin resistance, but diabetes develops only in those whose beta cell insulin production doesn't keep up. Remember, the beta cells are the cells in your pancreas responsible for making insulin. There's also another condition called prediabetes. This is not a diagnosis, but rather it's a condition that requires periodic retesting. There's a big study called the DPP, the Diabetes Prevention, I forget what program, that was it. And what the study found was that people who had prediabetes, 11% of them would develop full-blown diabetes during the 3-year follow-up. So you can think of prediabetes kind of as a yellow light. It's a big warning that you better slow down, because if you don't make changes in your diet and lifestyle, you're going to get full-blown diabetes. Prediabetes indicates what's called impaired fasting glucose. It means your blood sugar is moderately high after you eat, after you haven't eaten for a long time. Theoretically, if you're healthy and don't have any diabetes, if you haven't eaten for a long time, your blood sugar should be low. If your blood sugar still remains kind of high after not having eaten for a long time, that's because your insulin's not working that well, and usually because people with prediabetes are overweight, their fat cells are blocking their healthy cells. So the primary component of therapy for prediabetes is not taking meds, and it's not taking insulin. It's losing 5 to 10% of your body weight. That's the best thing a person with prediabetes can do. When you lose weight, your fat cells shrink in size. They don't go away, but they shrink in size, which allows your insulin that your pancreas is still making to do its job better. How do we diagnose diabetes? The left-hand arrow that you see is showing a fasting blood sugar. If you have not eaten anything for 8 hours and go and have your blood sugar tested, your blood sugar, which is also called your blood glucose, if the value is less than 100 milligrams per milliliter, that means you do not have diabetes, so you fall in the blue range, which is normal. If you have your blood sugar tested after 8-hour fast and it falls somewhere between 100 to 125, we say that that's pre-diabetes. And then if it's greater than or equal to 126, that's diagnosis for diabetes. Again, there's a lot of people in the U.S. walking around with undiagnosed diabetes. There are a lot of people walking around who are overweight and obese, both of which increase the risk of prediabetes and diabetes. For all of those values that you see on the left-hand arrow, they have to be confirmed on a separate day. So you have to come back and have another reading between 100 and 125 to be qualified as prediabetes, or greater than or equal to 126 to be qualified as diabetes. There's also another test called the 2-hour glucose test, where 2 hours after you eat or 2 hours after you're given a glucose test, a little drink with glucose in it, if your blood sugar is less than 140, that's normal. 140 to 199 is prediabetes. Greater than or equal to 200 is diabetes. Don't worry so much about the 2-hour because we really use primarily fasting blood sugar, or another value that I'll tell you about called the hemoglobin A1C to diagnose diabetes. Okay, kind of out of order, but pre-diabetes, just in summary, 5 to 10% weight loss is imperative if you're overweight or obese and have pre-diabetes. That's the only way to prevent your body from progressing to full-blown diabetes. 30 minutes of physical activity per day is recommended. And it's been shown that you can prevent or delay 58% of diabetes development upon diagnosis of pre-diabetes if you make diet and lifestyle changes. Again, you don't need meds and you don't need insulin. You need to exercise and lose weight. There's another blood value called the A1C, or the hemoglobin A1C. It's also called the glycosylated or glycated hemoglobin. And the best way to think about this is think about your red blood cells floating around. We want your red blood cells to float around in a healthy, non-sugary environment. The more sugary an environment is, the stickier everything gets, right? You spill regular soda on the ground, let it dry a little bit, you're gonna feel that sticking to your shoes. It's sugary, it's sticky. Okay? So if your blood is always full of sugar because you have high blood sugar, your red blood cells are going to get really sticky. We don't want that. If I test your blood and I look at your hemoglobin A1C value, the higher your blood sugar is indicates a higher value of A1C. Your red blood cell lifespan is about 120 days. And so what your A1C can do can measure your blood sugar pretty much over the last 2 to 3 months. And that's helpful for practitioners and people who have diabetes, because if you test just your blood sugar right now, if you do a finger stick and put it into a glucometer, it's just going to tell you what your blood sugar is right now, which is just a reflection of maybe the last thing you ate or the fact that you haven't eaten for a while. But it doesn't really give us a bigger picture. The A1C gives us a bigger picture. You can't draw your own A1C at home. You usually have to go to a lab and have them draw your blood. They send it out. It's a more involved test than just taking a blood sugar. But again, it gives us kind of a measurement of the last 2 to 3 months. How sticky is your blood? Okay? Most lab normals somewhere between 4 to 6%. So that's what percent glycosylation you have. The higher your percent, the stickier it is, which means the worse your blood sugar control is. Okay, so for diagnosing diabetes, you can actually draw someone's A1C. If we see that it's greater than or equal to 6.5%, that's also grounds for diagnosing diabetes. Damage to the large blood vessels leads to increased risk of stroke, high blood pressure risk, blocked arteries in your leg, and reduced blood flow. Okay? The really unfortunate thing about diabetes is that it damages both your large and your small blood vessels. So maybe you've heard that people who have diabetes are also at higher risk for heart disease. They are, because think of all the large blood vessels and large organs that require appropriate blood flow. Diabetes blocks or impairs that ability. So you see higher risk of stroke and heart disease with diabetes. But on the other side of the body, diabetes and uncontrolled blood sugars also damage the small blood vessels. Okay, the leading cause of preventable blindness in the U.S. is uncontrolled diabetes. The tissue in the back of your eye is the thinnest tissue in your body. And so sugar, if it's floating around your blood, can easily permeate that tissue and cause blindness. Excretion of protein in the urine can eventually, and kidney damage can eventually lead to kidney failure. So many people who are on kidney dialysis are there because of lifelong or years of very high uncontrolled blood sugars. There's also nerve damage called neuropathy that causes numbness and pain. Numbness affects balance and increases the risk of accidental injury. Also, uncontrolled diabetes is a big cause of amputation, people having to have different limbs amputated because of poor blood flow. So again, uncontrolled diabetes affects both small and large blood vessels. How do you know if you have diabetes? Some of the warning signs of diabetes include excessive urination and thirst, the presence of glucose in the urine. That's sometimes how parents notice it in little kids first. They go to change their diaper and it smells really sweet. That's all the sugar spilling over into the urine, just trying frantically to get out of the blood. People with diabetes initially will lose weight. Essentially, it's because their cells are being starved. That insulin's not able to take the sugar into the cells like it should. There's frequent infections of the skin, the gums, the vagina, and the urinary tract, vision disturbances or blurred vision, pain in the extremities, difficulty healing cuts and bruises, itchiness, drowsiness, or abnormally high glucose in the blood. So if you had your blood sugar tested, it would be higher than expected. Gestational diabetes is another type of diabetes that refers to abnormal glucose tolerance that appears during pregnancy. We'll talk about that later when we get to nutrition throughout the life cycle. For people who have diabetes, the amount of carbs that they eat in a day and the spacing of the carbs is the most important thing they need to get under control. So you should have carbohydrates, but they should come from healthy sources of foods like fruits, vegetables, whole grains, and legumes, and they should be spaced out throughout the day. Remember, I said that more than 90% of people with type 2 are overweight or obese. Losing weight is imperative for improving your blood sugar control. If you lose weight, your fat cells shrink, kind of frees up space for the insulin to take the sugar into your healthy cells where it wants to go. There are also techniques like carbohydrate counting and use of something called the exchange list for meal planning that can help people with diabetes. The last concept that we'll introduce in the diabetes material is called the glycemic index. The glycemic index, what's sometimes abbreviated GI, is a ranking of how food affects your blood glucose or your blood sugar levels. It's measured relative to the effect of a reference food. I'll explain what that means in a second. The notion is, though, that rapidly breaking down sugars are called high GI foods, and more slowly digested sugars are called low GI foods. So, for example, this glycemic index scale goes from 0 to 100. White bread is 100 on the glycemic index scale. It's almost pure sugar. Potatoes have a GI of 90, where something like kidney beans have a GI of 25. People who have diabetes use the glycemic index and learn which foods have lower GI to try to eat them so that their blood sugar doesn't spike as quick as it would if they ate a high GI food. Your book shows you the different glycemic indices of different types of foods. So let's compare potatoes and kidney beans. Potatoes have a higher GI, which means in a short period after eating, your blood sugar will rise with potatoes. Now, kidney beans, even if they contain the same number of grams of carbohydrate per serving, because of the presence usually of fiber and protein, that will temper the blood sugar spike. So you'll see that over time, your blood sugar doesn't rise as much when you eat a lower GI food like kidney beans. Okay? There are some limitations to the glycemic index. Okay? The Academy of Nutrition and Dietetics, formerly the American Dietetic Association, says that the glycemic index and another related concept called the glycemic load, they may provide modest additional benefit for glycemic control over that observed when total carbohydrate is considered alone. But really, in the bigger picture of things, the Academy of Nutrition and Dietetics does not recommend the glycemic index as a primary weight loss mechanism if you don't have diabetes. So the takeaway message here is that the glycemic index is helpful if you have diabetes, because those are the people who are really concerned about blood sugar spiking and how quickly that happens. For the rest of the population who does not have diabetes, the glycemic index for the most part is not going to be that helpful. Now, one thing, obviously, if you eat more kidney beans than you do potatoes, there's a lot of different beneficial nutrition things that you get in kidney beans that you wouldn't get in potatoes. As I mentioned, fiber and protein. So it doesn't hurt to look at the GI of different foods if you're interested or inclined, but know that if you don't have diabetes, the jury kind of is still out as to whether it's that effective. One of the beefs about the glycemic index is that it's based on 50-gram portions of food, which are not representative of typical serving sizes. You sometimes hear people say things like, oh, I don't eat corn and I don't eat carrots because they're high glycemic or high GI foods. But that's if you ate 50 grams of those foods, which you never would because that's a really large portion size. So keep in mind that glycemic index is based on portions of food that are not representative of what we normally eat, and it sometimes mistakenly can make healthy foods like corn and carrots look unhealthy if you consider a high GI food to be unhealthy.